At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Fibromyalgia on Wednesday, June 12th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hi, everybody. Welcome to the Sunday just before tomorrow, which is Memorial Day, and you're listening to Dr. Tom Roselle Live. I hope all of you are enjoying yourself. You're out kind of, visiting and doing, and perhaps going to memorial cemeteries and parades and the like. And remember, what you're celebrating today is the ultimate sacrifice of the belief system, the representation of that great experiment called the United States of America. So I hope that you will take a minute, not just to realize you got a long weekend, but to realize the people out there that gave you the opportunity to be free as a society and to be able to express yourself the way you want to do. So happy Memorial Day tomorrow. And I hope you have a great Sunday and Monday, and you're out doing someplace, perhaps you're traveling. But remember what the purpose is, and remember why we have this holiday. It's important to me. It's important to so many people that I served over the years. And we have to make sure that we're able to represent what that stars and stripe really means. I had a conversation with a young man in my family yesterday, and very brilliant young man. And he's at that place in life where, he has sensitivities, as we all did around age 19. And, he looks at the disharmony in things, if you will. And we talked about what, was happening in the world. And I tried to tell him we're not perfect as a society. We've made huge mistakes going, through the path, but we've gained momentum. We've changed, we've adapted. And we continue to understand that this is a land of freedom and opportunity, and it's up to us to protect it. And so that's what I want you to remember about what this weekend's all about. Let's get into the program. We've been talking about chronic pain patterns. We've been talking about fibromyalgia, and sometimes known as fibrositis or fibromyositis. They kind of go hand in hand, but chronic pain itself going in many different directions. There's distinguishing features of these things. Pain, no matter what it is devastating, and it can cause significant problems in function, the ability to be present in any situation. Sometimes we give up because of it, because, we say, why am I still here? So what I'm trying to bring across to you in the programs that we've done over the last couple of weeks, and on June the 12th at the Roselle Center for Healing in Fairfax, and you're all invited, and please register for that class. If you've had pain of any kind, it just won't go away. I promise you, I'm going to give you the pattern that you need to appreciate, understand what it is that you can do to make a difference in that pain, and perhaps once and for all, get away from it, get it out of your life where you didn't know that you could, because you've been on drugs, you've been doped up, you've been kind of numbed up, and your productive level in your own presence, your own life, your own family is not there anymore. So we're going to do that on the 12th. You can register by going to drtomroselle.com or rosellecare.com. You want to do it the old-fashioned way, it's real simple. 703-698-7117. That's 703-698-7117. And just, make that happen, register for the class, and we'll have some fun that night. And those of you who attend, I'm going to give you an outline of a paper that I wrote and presented some years back. It's called fibromyalgia, the undisease. And that means that nobody knows in the medical arena the why behind it. And there's actually very specific reasons why this comes about. And we're going to talk about some things like that today and kind of move forward on the subject. But I want you to understand, fibromyalgia is not just pain in your right arm. Fibromyalgia is not just this ongoing neck and shoulder pain that doesn't seem to want to go away. Those are painful conditions, and numbness and tingling that radiates in your arms, and sometimes your low back pain, that's numbness and tingling and goes down your legs. But it's much more than that. And we said that it affects all four quadrants within the body. That means you have to have it all over the place. It's not a joint space problem. It's the fibrous connective tissue, if you will, that is irritated in those joint movements or in the muscle fibers. And there's very specific defined characteristics and laboratory findings, even though your physicians, unfortunately, a lot of them don't know about it. But in the medical arena, they don't know why. They don't know why this shows up. And, there's things that can trigger the presentation. We know that injury, car accidents, falls, bad dental work, and I'll tell you all about that on the 12th as well, that can cause this exaggeration of pain that suddenly affects the whole body. Infections, particularly viral patterns. We're seeing a lot of fibromyalgic-like conditions that are showing up as a result of the last few years, because we had all kinds of viral exposures that were sometimes we didn't have the opportunity to handle them. I mean, physiologically opportunity to handle them, because we beat up our bodies so badly over a period of time. But also importantly, the vaccines that tied up our body's ability to handle different types of pain signaling within the system. And by the way, fibromyalgia is not necessarily an inflammatory reaction, although that inflammation can kind of hang out with it over a period of time. Fibromyalgia has a very specific physical and physiological cascade, if you will. Now, people with, a trauma, whether it's physical trauma and also emotional trauma, PTSD patterns and so forth, can present as a fibromyalgic patient. Why is that? The thing that I want you to remember, there's nothing that happens to your body in a state of disease, dysfunction, disharmony, or in a state of health and well-being and maximization that doesn't stem from an irritation or an optimization of three things: injury to the body in some way, significant or minor, or supporting that by exercise and so forth. And the chemical side has to do with anything that's outside the body, or we say exogenous to the body. And when we take that into consideration, we have to look at the chemistries, the things we eat, the things that they put in the things that we eat, the electrical fields that are around us, and so forth. And then the third piece is the mind, the decision processing. And that can be affected by so many other things. But, the old cliche, if you think you can, you can. If you think you can't, you're right. That's what we're talking about. And it has a profound physiological impact on your system. We're going to be talking about a lot of that. And it's important that you understand it. So stress, that's there for a long period of time, can be a huge triggering pattern that we don't know how to break it. But that stress pattern, stress kills. Well, it does, because it causes other systems not to work. Now, you got to fix those other systems once they're involved. You go out and hurt yourself, and you're sitting at a stoplight and somebody rear ends you, or you hit somebody else, and there's a whipping condition that occurs that affects the lower part of the brainstem, and we call that the vestibular area of the brain, and then the cerebellar area of the brain. And those control muscular movement and function and memory patterns physiologically. So if there's anything like that, we have to make sure that we understand the mechanisms. What if I told you that so many of you are walking around with a upper neck called cervical spine dysrelationship in a way that it's affecting the coaxial cable called, your spinal cord, because that's what the spinal cord looks like, by the way. If you took it and sliced it kind of half, you see all these fibers and these tracks going down, affecting other parts of the body, just like something come out of your hard drive of your computer. And they have signaling mechanisms. But if you irritate that, if you signal the wrong sensory patterns of the body, you can end up with huge amount of pain. So there's an interesting pathway biochemically as well and hormonally. The statistics show that more women are affected with fibromyalgic conditions than guys do. Although guys, you're pretty close. You're there, except we suck it up and we do things. So that means that there's an estrogenic pattern that's being affected. Has a lot to do with the fight-flight system, has a lot to do with the adrenal system. And we'll go through that a little bit and talk about it and show you exactly what's going on. And, so we have other things like degenerative arthritis that goes too long and that constant pain signaling, it ramps itself up. And, autoimmune conditions like lupus and rheumatoid and Sjogren's and all of those lovely little things that show up. And now the autoimmune conditions that we're seeing is post-COVID because we don't have the immunological responses that we used to have, particularly if we were vaxxed. And if that's the case, then you have to know that there's a viral component to this that we've talked about for quite some time with our patients, and we've shown it to them. And when we've found it to be true, then we have to treat other types of pieces. Now, we talk about risk factors, gender. We talked about, a family history that may or may not be contributory to fibromyalgia. Some of the literature says that if you have a sibling, if you have a parent, if you have, somebody in your family that's had this condition, that you're going to be more predisposed to it. So here's the deal. It's never been shown clinically, only symptomatically, that it seems to run that way. Clinically, when I say that word clinically, I mean genetically. So, but you have familial patterns and you have genetic patterns. So what's the difference between the two? A familial pattern has to do with this. If you walk like a duck, you're probably a duck. Well, what happens if a chicken grows up in a duck family? It starts walking like the duck instead of a chicken. Is it become a duck? So just because somebody has pain patterns that seem to be connected within family, it could simply mean that because you live like them, you eat like them, you do things, you think like they do, you stress like they do, those are the triggers, but it's not a genetic situation. Now, those epigenetic patterns can express certain conditions and subsequently produce that widespread pain pattern with little things that take place. Fibromyalgia has to do with a profound fatigue pattern. And here's where this comes in. What happens if I told you that there's a lot of linkage between fibromyalgia and viruses, but particularly Epstein-Barr virus? Epstein-Barr virus and mononucleosis as a young person are reflected in people who have everything from restless leg syndromes to sleep apneic patterns to just not being able to stay awake more than a few hours at a time and so forth. So there's that piece that we're looking at. Could it be possible? It could be possible. And all of a sudden it starts affecting cognitive function, the ability to pay attention, the ability to concentrate, to do mental tasking. So we see that, and then we see other coexisting conditions, and like we just talked about, the fatigue pattern and irritable bowel. Now, what do those two things have in common? We're going to walk through a couple of these for you today. The irritable bowel pattern, and the fatigue pattern both could be a viral pattern. One of the things that we do when we suspect an adrenal, we do something called an adrenal stress index, okay? And when we run that, we see the different pieces of fight flight within your body. Now, when we do the test, there's something else that shows up, and it's called an IgA antibody response. Your IgA antibody is your first line of defense. You'll hear me talk about it as being a picador. They weaken things up so the rest of your body can kick in and really nail these guys. And it starts from your mouth to your butt and all that mucus presentation in between. And so what happens is that if that IgA is not at the levels that it should be, then you're going to have all these incoming heavy metals, all these incoming viral patterns, all these incoming other microorganisms that are going to invade your system and subsequently can cause a pain cascade that you don't know where it's coming from. People who've had, headaches of all kinds, migraines and so forth, that constant pain pattern that presents itself that could be due to an out of position of vertebrae anywhere in your spine or structural pieces anywhere in your body. If that pain cycle isn't taken care of, if that, in my world, we call it a spinal subluxation. In the osteopathic world, they call it a spinal lesion. If that's not dealt with properly and restored to normalcy and allow the tissue around it to optimize and support that fight flight reaction problem. We talked about temporomandibular joint, TMJ problems. Your jaw, if you will, the temporomandibular joint, that's got, it's hooked in and expresses itself in that lower part of your face called your mandible. If that's not sitting properly, then it's going to affect the 22 bones that make up your head, and it can cause excessive pressure and also bad signaling from the brain and the spinal cord to the rest of the system. So we're looking at all these pieces of the puzzle, and we're looking at, okay, so they're there, what caused it? So we know we talked about infection, we've talked about injury patterns, we've talked about things that build up slowly. So the risk factors, sex, yeah, meaning your genetic pattern. And by the way, people, just because somebody out there thinks that they might be a transgender woman doesn't mean that you're going to have fibromyalgia more so than you're still an XY, and it still shows up as an XY, not as a woman who is a double X. Sorry, that's just the way it is. Medically, there is no distinguishing feature. Your social interaction is one thing, but your medical interaction has to be looked at simply as who you are and what you were born with. So when we look at those other disorders where osteoarthritis and rheumatoid and lupus and fibromyalgia and all those things together, are they indistinguishable one from the other? Yes, they are, if you know what you're looking for. Or distinguishable, I'm sorry. If they're distinguishable one from the other, yes, they are. Sometimes they're not distinguishable, and we think they're all the same thing. Rheumatoid arthritis causes pain in a very specific pathway. The ongoing process of the reoccurrence, the ramping up, is problematic. So we're going to look at all those on the 12th, and I want you to make sure that if you know someone that's hurting, if you're hurting, there's no reason. After 47 years of practice, we've been able to touch and help and turn people's lives around by treating the cause, not the symptom process. When you treat the symptom process, you get more of the same in different directions over a period of time. When you treat the cause, you can actually put the fire out, and you help and coach and direct people. I was watching a YouTube presentation the other day, and this doctor was going on and talking about exercise and how it has a profound effect. And just simply walking, as you've heard me say many times, 2 miles every day. I don't care how fast you do it. Put your headset and go for a walk. Just 2 miles. And nice and easy, nice and slow. Think about the things that you need to think about. And you will decrease your risk of dying of a pathology by 50%. But here's another piece of the puzzle. If you exercise every day, for every hour you exercise over your lifetime, you increase your longevity by 3 hours. Do the math. It's kind of incredible, right? So wouldn't it help you to exercise? But we also know this. People who gently exercise increase their oxygenation to their body, dramatically increase their energy patterns. And we're not talking about Olympian exercise. We're talking about gentle movement, stretching, bending in a chair, moving around, lifting your legs up, getting to go, get off your derriere, and put the remote switch down and go do something, walk up your stairs. My mother used to come to visit us. God rest her, she's been gone now for a lot of years. And she had bad habits, but she'd come in and she was in a lot of pain. Well, in my house, opposed to her house, she had to walk up and down the stairs every day because our bedrooms were upstairs. In my house, we would not let her have the alcohol that she was used to having, and she got treated, a couple times a week while she was here. And I was always doing damage control because she'd only stay for a month. But she would go back so different, so vital, so able. And I want to make sure that you know and you have the tools to really understand what you can do to fix, repair yourself, and turn things around. Your body's an incredibly forgiving organism. And as long as you're breathing, you're repairing cells and you'll begin to change it. So on the 12th of June 12th, coming up pretty quick, about 2.5 weeks from now, register for the class. Go to drtomroselle.com and register. And remember, we have limited spacing. We had a great time on our last session. A lot of people, house was full. And we'd like to encourage you to come and find out information. It's up to you. Then you can do what you want to do with it. There's no cost to this thing. People say, well, what are you trying to sell? Just nothing. Just show you your health. We'll give you an opportunity to, come in and see one of our amazing practitioners who really know their stuff. But this is for you. This is ongoing. You deserve to have the data. You deserve to know more than your physicians know, because unfortunately, the medical structure in all healthcare schools today are not as good, in my opinion, of what they were years ago. So we want to make sure you have it. Now, don't forget, immediately after this program, I go to live stream. Okay. So make sure you're there with me. It's, Ageless Health live stream. And follow me on all the social media sites. Please follow me, because then I can get more information out to everybody. And that's the reason I do it. You need to have this data. Follow me on Facebook and on Rumble, on YouTube, on LinkedIn, and so forth. We're there on all of them. Follow me and like us. Send me notes. Tell me what you want to hear. We'll get it done. But immediately right now, in just about a minute, we're going to go to live stream, Ageless Health. Click it. You can go to one of the social sites or go to drtomroselle.com. There's going to be a screen right there in front of you. Click the button, and I promise you we're going to have a great program for you. This is fun for me. Somebody asked me the other day, why do I keep doing this? And simply, one, because I enjoy educating people. I enjoy making you think differently and not get stuck. But I do it for one very, very significant reason. You deserve the information, but more importantly, I love you all. You have a great week. Join me right now. I'm going to live stream as we go.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Fibromyalgia on Wednesday, June 12th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.